second and last slide here, right? So, hypoparathyroidism, the incidence of hypoparathyroidism is actually really low because most of the doctors that end up doing grave surgery are experienced. Oftentimes the doctors who are not, surgeons who are not very experienced or don't have a large number of patients, try to avoid because these are harder operations, all right? And so someone with more expertise should be doing them. And so the incidence of hypoparathyroidism, because you can transplant the parathyroid and have it survive, is around 3%, okay? Now, before 5 or 7 years ago, hypoparathyroidism was really challenging to treat because the only thing you could do was just give the patients high doses of calcium and vitamin D. And now we have actual injectable PTH, the parathyroid hormone, that can help support. It's, again, not the same as you having your own organ, adjusting according to your needs, but it does work fairly well, and it can supplement patients who are taking calcium and vitamin D and are not able to manage their problems and symptoms well. All right. Vocal cord paralysis, the incidence is 0.9%, and this is for Graves' disease. Not too dissimilar to patients who have thyroidectomy for cancers or other conditions, right? And that's mainly because finding the nerve is not too challenging if you go away from the gland and then tracking it upwards. And you can take as much time as you need to protect that nerve because it's well worth doing so. So oftentimes thyroid surgeons take a lot of time protecting that nerve. Now what you get more often in Graves' disease is postoperative bleeding, right? So the incidence is 1%, still very low. But compared to a regular thyroidectomy, the incidence is 0.001% of the time. It's significantly higher, right? And the reason for it is that you have an inflamed thyroid, which is now highly vascular. So the blood vessels that are feeding the thyroid, you can see them here. You have one set at the bottom and one set from the top on each side feeding the blood vessel. But when you have Graves' disease, not only do those blood vessels get bigger, all the blood vessels on the surface of the thyroid gland also become exaggerated because they're bringing more blood flow. Now, the other problem with inflammatory processes is that the chemical condition of the thyroid gland causes more blood vessels to grow into the gland. You know, the immune system works by chemical warfare in a sense, right? When you have a cold, and when you're a child and you have a cold, your immune system attacks it. You know, children will get fevers to 104, 105. As an adult, it's rare for you to get temperatures that high. And that's because an immune system of the child is immature and doesn't realize how hard to attack a virus. So it attacks DEFCON 4 as if it's Ebola, right? And you get very sick, the child gets sick, high fevers, potentially even get seizures because of those high fevers. And with each cold, it learns, I don't need to go to that level. This is not Ebola, this is something else, right? And it decreases, it learns, the immune system learns, right? But it has the full capability of that attack and its powers. And so when you have autoimmune disorders, you oftentimes are exposed to the full armamentarium of the immune system attacking and doing its thing, right? And that's why the thyroid gland can become very swollen, very enlarged, very vascular, and cause scarring and inflammation around it, making the surgery a little bit more challenging. Okay? So the risk of bleeding becomes a little bit more, but still an acceptable risk. Now, in patients who don't have Graves or autoimmune-related thyroid disease, when you do thyroid surgery, you can even potentially do it on an outpatient basis. But patients who have Graves disease stay in the hospital, monitor those patients overnight to make sure that bleeding and things like that don't occur, just as an extra measure of safety. Okay? And then the other thing that you find a high percentage of is incidental finding of a thyroid cancer, right? And that sounds alarming, but it actually really isn't. So there are studies that have looked at populations in terms of incidence of thyroid cancer. And in the past 20 years, there are increased reports of thyroid cancers being detected and operated on. But when they've done these studies in the morgue, where patients have come in from heart attack, car accidents, whatever, and they've looked at their thyroids to see if there's any cancer in them, anywhere between 10 to 30%, based on the location, have incidental thyroid cancer. These are thyroid cancers we call microcarcinomas, small thyroid cancers, majority of which never really grow and cause problems, right? So this incidental finding of thyroid cancer of 10%, 9% of that 10% are these microcarcinomas. So maybe 1% of these incidental findings are actually potentially meaningful. That's something, right? So these are patients who didn't have big nodules, right? Didn't have a biopsy-proven thyroid cancer. These were incidentally found.